Fatty liver disease, what is it? The largest organ in your body is your liver. It aids in food digestion, energy storage, and toxic elimination. Fat accumulates in the liver in a condition called fatty liver disease. There are mostly two kinds: disease of non-alcoholic fatty liver, NAFLD, alcoholic steatohepatitis, another name for alcohol-induced fatty liver disease. What is non-alcoholic fatty liver disease, NAFLD? Fatty liver disease of the NAFLD variety is unrelated to excessive alcohol consumption. Two categories exist: simple fatty liver, which is defined as having fat in the liver but little to no inflammation or damage to the liver cells. Usually, simple fatty liver does not progress to the point of causing problems or damage to the liver. Non-alcoholic steatohepatitis, NASH, characterized by hepatic fat accumulation in the liver, as well as inflammation and damage to the liver cells. Liver fibrosis or scarring can be brought on by inflammation and injury to the liver cells. Liver cancer or cirrhosis can result from NASH. Alcoholic fatty liver disease, what is it? Heavy alcohol use is the cause of alcoholic fatty liver disease. The majority of the alcohol you consume is broken down by your liver and eliminated from your body. However, the breakdown process may produce hazardous materials. These chemicals have the potential to harm liver cells, increase inflammation, and impair your body's defense mechanisms. Your liver will suffer greater damage the more alcohol you consume. The initial phase of alcohol-related liver damage is known as alcoholic fatty liver disease. Cirrhosis and alcoholic hepatitis are the subsequent stages. Who is at risk for fatty liver disease? Non-alcoholic fatty liver disease, NAFLD, has no known etiology. Researchers are aware that it is more prevalent in those with type 2 diabetes and prediabetes as well as obesity. Are middle-aged or older, though younger people can contract it. Are Hispanic, with non-Hispanic whites coming in second. In African Americans, it is less prevalent. Have elevated blood fat values, including triglycerides and cholesterol. Your blood pressure is elevated. Utilize specific medications, such corticosteroids and some cancer medications. Suffer from specific metabolic conditions, such as metabolic syndrome. Lose weight quickly. Have been exposed to certain toxins. Have certain illnesses, such as hepatitis C. Approximately 25% of people worldwide suffer from NAFLD. In the U.S., the prevalence of NAFLD is increasing along with that of obesity, type 2 diabetes, and high cholesterol. In the U.S., NAFLD is the most prevalent chronic liver disease. Only heavy drinkers, particularly those who have been drinking for a long time, are susceptible to alcoholic fatty liver disease. Women who drink excessively, those who are obese, and those who have specific genetic abnormalities are at a higher risk. What are the symptoms of fatty liver disease? Both non-alcoholic fatty liver disease, NAFLD, and alcoholic fatty liver disease, AFLD, typically have few to no symptoms. Should you experience any symptoms, you might feel worn out or experience pain in your upper right abdomen. How is the diagnosis of fatty liver made? It might be challenging to diagnose fatty liver disease because symptoms are frequently absent. If you have abnormal findings from liver tests that you have for other reasons, your doctor might assume that you have it. In order to diagnose you, your doctor will: medical background, a physical examination, various testing such as imaging and blood tests, and occasionally a biopsy. Your doctor will inquire about your alcohol consumption as part of the medical history to determine whether liver fat indicates non-alcoholic fatty liver disease, NAFLD, or alcoholic fatty liver disease, AFLD. In an effort to ascertain whether a medication is the source of your NAFLD, he or she will also inquire about the medications you use. Your doctor will inspect your physique and take your height and weight during the physical examination. Your physician will search for indicators of fatty liver disease, like an enlarged liver, cirrhosis symptoms like jaundice, which is a yellowing of the skin and whites of the eyes. Blood tests such as blood count and liver function tests are probably in store for you. In certain situations, you might also undergo imaging tests, such as ones that measure liver stiffness and fat content. Liver scarring or fibrosis may be indicated by stiffness in the liver. A liver biopsy may occasionally be required in order to confirm the diagnosis and assess the severity of the liver damage. What are the treatments for fatty liver disease? Losing weight is advised by doctors for non-alcoholic fatty liver. Losing weight helps lower inflammation, fibrosis, and liver fat. You should cease taking a medication if your doctor believes it is the reason behind your non-alcoholic fatty liver disease, NAFLD. However, consult your physician before quitting the medication. It could be necessary for you to gradually stop taking the medication and transition to an alternative. No medications have been licensed for the treatment of NAFLD. Further research is required to determine whether vitamin E or a specific diabetes medication can be helpful. Quitting alcohol is the most crucial step in treating fatty liver disease associated with alcohol consumption. You might wish to visit a therapist or take part in an alcohol rehabilitation program if you require assistance with that. Additionally, there are medications that may lessen your alcohol cravings or make you feel ill if you consume alcohol. Cirrhosis can result from nonalcoholic steatohepatitis, a kind of non-alcoholic fatty liver disease, as well as from alcoholic fatty liver disease. Doctors can employ medications, surgeries, and other medical treatments to treat the health issues brought on by cirrhosis. You might require a liver transplant if the cirrhosis progresses to liver failure. Which lifestyle modifications can be beneficial for fatty liver disease? Here are some lifestyle modifications that may be beneficial if you have any of the following forms of fatty liver disease. Consume a diet rich in fruits, vegetables, whole grains, and low in sugar and salt. Vaccinate against pneumococcal illness, the flu, and hepatitis A and B. Liver failure is more likely to occur if hepatitis A or B is combined with fatty liver. The two additional immunizations are crucial because infections are a common occurrence in individuals with chronic liver disease. Engage in regular exercise to help lower liver fat and lose weight. Consult your physician prior to utilizing any complementary or alternative treatments, medical procedures, or nutritional supplements such as vitamins. Your liver may be harmed by certain herbal medicines.